At this ASCO, I had the privilege of presenting the initial data of part 1 of MagnetisMM-6 that explored Elranatamab in combination with Daratumumab and Lenalidomide in transplant-ineligible patients with multiple myeloma. This data is highly exciting because it marks the beginning of a shift of moving a T-cell redirection therapy upfront. There's a strong scientific rationale to this combination. Combining Elranatamab with Daratumumab and Lenalidomide effectively engages both the adaptive and the innate immune system, and this synergy allows for a robust anti-myeloma response. The data presented at ASCO specifically focuses on level dose G of the study, which includes Elranatamab 76 mg subcutaneously every 4 weeks, together with standard dose of Daratumumab 1,800 mg and Lenalidomide 25 mg. And amongst the 37 patients enrolled, median age 75, a quarter of whom were classified as frail, we saw a quite predictable and manageable safety profile. The adverse events were very much in line with the expectations of the individual drugs. Hematological toxicities occurred in around 80% of patients. Grade 3 or 4 neutropenia occurred in around 73% of patients, but grade 3 or 4 anemia and thrombocytopenia were less frequent, occurring in around 19% of patients and 11% of patients respectively. Infections occurred in around 70% of patients, but grade 3 and 4 infections only occurred in around 19% of patients. CRS, as expected, occurred in around 62% of patients. All were grade 1 and 2, and there was only one case of grade 2 ICANS. From an efficacy perspective, we saw quite an impressive response with an overall response rate of 97.3%, and 50% of these patients had a VGPR or better, and 27% had a CR or better. And what's important is that the response was quite durable, such that at a data cutoff with a median follow-up of around 8 months, the vast majority of patients are still responding. So going forward, the randomized phase 3 portion of MagnetisMM-6 is forthcoming in part 2, and this will be evaluating Elranatamab, Daratumumab and Lenalidomide at the described schedule and dose in comparison with Daratumumab, Lenalidomide and Dexamethasone in transplant-ineligible or transplant-deferred patients. Overall, I do think that the MagnetisMM-6 is a very important study because it heralds a new era, one in which total immune therapy is brought up front, prolonging survival with the ultimate aim of helping our patients with myeloma reach their natural lifespan. And if we can do that with just one line of treatment at the outset, that will be quite transformative.